So we have 76th question. Ulipristal acetate. Ulipristal acetate is progesterone receptor modulator. So this is SPRM, that is selective progesterone receptor modulator. It is saying should not be prescribed to a woman as emergency contraceptive in women with A. glaucoma, B. liver dysfunction, C. kidney failure, and D. is coagulopathy. So the answer will be liver failure. Why? Because ulipristal acetate is metabolized in liver. So it is metabolized in liver. So ulipristal is metabolized in liver via CYP3A4. So in the case of severe hepatic impairment or liver dysfunction, ulipristal is a contraindication. Glaucoma is not a contraindication. Kidney failure is not a contraindication. Coagulopathy not a contraindication. In fact, ulipristal can reduce bleeding in the case of fibroids if used. So emergency contraceptive ulipristal acetate, which can be given up to 5 days, that is 124 hours. It is most common effective oral emergency contraceptive. Coming to next question number 77. Injectable medroxyprogesterone. So injectable medroxyprogesterone IP 150 mg per ml contraceptive injection is available in the Family Health Program of the Government of India under the name of. So what is the name? So answer is Antara. So Antara is Government of India's brand name for DMPA. So Government of India's name for the DMPA. The dose is 150 mg IM. It is given every 3 months. So it is given every 3 months, that is 13 weeks. It was introduced under National Family Planning Program, NFPP, National Family Planning Program. Why not others? Saheli is Saint Croman, oral, non-hormonal, weekly pill. Cyana Press is DMP, that is correct. Just like Antara, it is DMP, but it is not Government of India. It is not Government of India program brand. Cyana Press is available in 104 mg and it is given subcutaneously, not intramuscularly. Then Sahiba is not a government injectable contraceptive. Saheli, so this was the correct answer. Now coming to the next question. Which of the following are the major complications of oral pill? So cholestasis, jaundice, chloasma and acne, venous thromboembolism and breast cancer. So they all are the complications of oral pill. But the question is asking what is the major complication of oral pill. So major complication will be first cholestasis, jaundice. Yes, this is correct. This is a recognized major metabolic or hepatic complication of OCP. Second is chloasma. Chloasma is a complication, but it's a minor complication. It's a cosmetic complication. Then venous thromboembolism. Yes, this is correct. They can cause DVT. The OCPs also can cause pulmonary embolism. So it will be major complication, embolism. Then you have the breast cancer. Yes, this is correct. Current breast cancer is a contraindication. So if a patient is having breast cancer, the OCPs are contraindicated in men. So this is the correct answer. So 1, 3 and 4. So C is the correct answer. Chloasma and acne are the minor one. Then which of the following condition are indication of removal of IUD? So there is a patient in whom you have placed IUD. Now in which condition you are going to remove that intrauterine device? So the first is persistent irregular uterine bleeding. Second is perforation of uterus. Third is pyelonephritis. And fourth is pregnancy with device in situ. So the first one, persistent irregular uterine bleeding. Yes, this is correct. This is correct. In the case bleeding is persistent, troublesome, and it is not responding to treatment, IUCD removal has to be done. Perforation of the uterus, absolute indication. Yes, this is correct. And if the IUCD is extrauterine, you have to even do laparoscopy. Pyelonephritis, no. Pyelonephritis is the upper urinary tract infection, upper UTI, and it is IUCD is in your genital tract, not urinary tract. So pyelonephritis is not a indication for removal of your IUD. Then pregnancy with device in situ. Yes, if the pregnancy has occurred and IUCD strings are visible, removal is indicated because, so if strings are visible, then go for removal, because IUCD will do, it will increase miscarriage risk. It can also cause septic abortion. It can also cause preterm labor. So fourth is also correct. So answer will be 1, 2 and 4. So B will be the correct option. Then coming to next question. A 25-year-old newly married female on liver enzyme inducer. So that female is on liver enzyme inducers, which can be like phenytoin, carbamazepine, phenobarbital, or rifampicin is there. So is requesting contraceptive advice in family planning clinic. Which of the following will be the most reliable method? So it will be the most reliable method of contraception for her. A is combined oral contraceptive pill. So first is combined oral contraceptive pill. So we know that the combined oral contraceptive pills, they are enzyme inducers, so effectiveness of OCPs will be reduced. Why? Because hepatic enzymes are induced. So OCPs will be metabolized faster, and there is chance that OCPs can fail. So first is wrong. Second is male condom. Male condom is not affected by enzyme inducer, but this is not most reliable. Why? Because it is user dependent, so user failure can occur. In the same way, diaphragm is also very less effective. Coming to Depo-Provera injection. Depo-Provera injection is depot medroxyprogesterone acetate. Depot-medroxyprogesterone acetate, and they are not affected by enzyme inducing drugs. So D will be the correct option. So if a patient comes to you in the clinic and taking any enzyme inducer, which may be phenytoin, carbamazepine, phenobarbital, or rifampicin, you can go for copper IUD, copper IUCD. You can go for LNG IUS, or you can go for DMPA or Depo-Provera.